buy the equipment, but then you have to pay them $125 to $150 every time you treat the patient. They control every treatment. So it's a model set up to really rip people off, and I don't like it. And I don't believe it's that special, so I'm looking for a cheaper way to do it. The inflammation story you know about. There's so many different issues that cause inflammation, whether it's, again, toxic burden, trauma, infections, elevations in blood sugar, or high blood pressure. And they create oxidative stress. We're always using oxygen to make energy, and we're always making free radicals that are then quenched by antioxidant, by the vitamins like vitamin E, etc., or superoxide dismutase. But if the balance becomes excessive and there's too much of a free radical burden, it creates injury to the molecules of the brain. And these injuries are tiny, and the system has huge reserves. Hence, these events occur over a great deal of time, and the changes that occur to people occur very slowly. And unfortunately, inflammation creates more inflammation, stress, and cellular injury. Next. So there are some products that clearly seem to have some benefit and have been shown in animal models and even in some early human studies to be useful. Curcumin, which is from turmeric, is useful. The problem with curcumin is that it's lipid soluble and it's not easily absorbed. It's not profoundly expensive, but if you combine it with black pepper extract, bioperine, it enhances the absorption and reduces the inflammation. Next. This just is a complex slide that shows that curcumin works in quite a few different ways to help reduce inflammation in the body, and I feel like it's more for practitioners, so just let it be said that it's a good product. Next. Resveratrol is an interesting product because it helps modify the activity of sirtuins. And activation of sirtuin extends lifespan and promotes longevity and healthy aging in a variety of species studied by delaying the onset of age-related neurodegenerative disorders. Next. And in mammalian species, these sirtuin activators protect against axonal degeneration and all these other fancy medical terms that you may or may not want to know, so you can always look at the slide and copy it later. Next. So they found that giving mice with amyloid plaques red wine with high concentrations of resveratrol slows their memory loss and brain cell decline, adding to a body of science linking resveratrol to slowing the Alzheimer's disease-related symptoms. Next. And the problem with it is that they really don't have good human studies until this month, when I have a study that definitely showed that resveratrol, I think the dose was 500, increases, at least was demonstrated to increase blood flow to the brain by a reasonable measurement. Now, it doesn't show that it affected sirtuin or did anything else, but at least at last, there's finally a human study after all this yapping. And they did show adequate absorption, etc. So certainly I can revisit this, but I still think I have a better product. Next. This is an extract of pine bark, and many of you know I recommend it. And I recommend it because it does have an abundance of human studies. And I believe it does what resveratrol does, but it does it, in my mind, better because it's better absorbed and utilized. Next. So it improves chronic venous insufficiency insofar as it reduces the pain and congestion in the legs. It antagonizes the effect of stress hormones on blood vessels and prevents constriction or vasoconstriction. It dilates small blood vessels, and it increases the production of nitrous oxide in those endothelial cells which line all the muscular arteries and arterioles of your body, something we really want. And it decreases the stickiness of platelets, so that for those who are at risk to having problems related to thick blood that gets sticky and clots, it's helpful. Next. And it has very significant anti-inflammatory effects. It's reduced CRP, a common marker for inflammation, by up to 60%. It reduces fibrinogen, a contributor to blood clotting, a marker of inflammation, by 60%. These are all human studies, and they're good studies. Reduced in osteoporosis, reduced pain in osteoporosis by 50% using a standard scale called WOMAC. It improved walking distance by a factor of 3, and reduced the need for prescription drugs. Nothing's perfect, but it helped. 70% of the patients had a reduction in ankle swelling as well, in part because of the venous benefits. Next. It has an antioxidant effect, so it helps quench free radicals. 70% reduction in plasma free radicals as measured by F2 isoprostane, a very useful and common marker for inflammation. It's an inflammation of fatty tissue, and so it's a bit more enduring as a marker in the system, and it's probably one of the key markers in good scientific studies. It protects against oxidative stress in several cell systems by doubling the intracellular synthesis of an antioxidant enzymes such as superoxide dismutase. So if the producing energy is like a sort of a bucket brigade where hot molecules are passed from one processing center to another within the mitochondrial systems, and each one produces a hot molecule, and some of those hot molecules escape, and the body and vitamin C and CoQ10 and vitamin E all help quench it. But when they quench a particular molecule, they've just passed it on to be quenched. That created a new molecule that has to be quenched by yet another. And this is the money molecule, and you can't take it as a supplement. You've got to make it yourself. So the fact that there's some real good evidence that we have a product that improves the production of that is very, very good and valuable, because it's the low levels of superoxide dismutase are seen in people with chronic illness and associated with chronic aging. And it regenerates the active forms of the vitamin C and vitamin E that quench further free radicals. That's why it's so good. Next. And there was a good study in people where they did actually look at biomarkers of oxidative stress and cognitive performance. Next. Double-blind, placebo-controlled, match pair. Really good research, not the normal junk that we get in the supplement world. A daily dose of 150 milligrams, so we know the dose that's needed. And usually I take 100 twice a day just because it's easier, but you could take probably anywhere between 50 twice a day to 100 twice a day for 3 months. Next. And people were assessed at baseline and then intermittently. And next. And these are the cognitive tasks, attention, working memory, episodic memory, psychomotor.